There's two broad types of diabetes: type 1 diabetes, type 2 diabetes. Type 1 diabetes, the problem is the body doesn't make insulin at all, and those people require insulin from day one. Type 2 diabetes, which is by far the most common type of diabetes, it's where the body doesn't make enough insulin to control the blood sugars. And so people with type 2 diabetes have elevated blood sugars. A portion of those people will go on to the point where their body stops making insulin altogether. But the primary difference between type 1 and type 2 diabetes is that people with type 2 diabetes don't require insulin on the first day of diagnosis, although they may require it later on. Type 2 diabetes is by far the most common. It's very common in Mississippi. In fact, we're either number one or number two in terms of states with the percentage of adults who have type 2 diabetes. Type 2 diabetes runs in families. It's more heritable than type 1 diabetes. So if your grandparents and parents have type 2 diabetes, you have a really, really high risk of going on to have type 2 diabetes. Type 2 diabetes is associated with obesity and being overweight. There's actually a strong association with obesity and being overweight, which is also one of the reasons why we also lead the country with type 2 diabetes, because we're also 1, 2, or 3 in terms of the state with the number of adults with obesity who are overweight. We know that being overweight or having obesity is associated with what's called insulin resistance. That's where the insulin that you have on board doesn't work as well, and your blood sugar can tend to be higher than normal. Many people are in a condition called prediabetes. Those people have blood sugars that are not normal, but they're not in the diabetes range. And in those people, they have a higher risk of going on to have type 2 diabetes over the next 5 years. The group of people who have prediabetes is thought to be 1 in 3 adults. And the rate of prediabetes is even higher as you get older. So above 60, the rate of prediabetes is thought to be 1 in every 2 adults. And we know that when we have people with prediabetes and we deliver interventions that help them lose a little bit of weight and engage in regular, moderate physical activity, that we're able to reduce their risk of going on to have type 2 diabetes in the future. For some people, we can actually eliminate their risk, which brings us to some of the benefits of weight loss surgery, particularly in those people who don't yet have diabetes. So the weight loss that can typically come from weight loss surgery can help delay or totally prevent the progression from prediabetes to type 2 diabetes, even if you have a very, very strong family history. And we know through studies on other interventions that give less weight loss, but also helps people to do the regular physical activity, we know that you're able to delay or prevent type 2 diabetes in those groups, and that effect lasts for years, even decades. So if you're considering weight loss surgery and you are at a high risk for diabetes, one additional reason for considering weight loss surgery is that your risk of diabetes will change with weight loss surgery. Not only preventing type 2 diabetes, we know that weight loss is an effective means of treating type 2 diabetes. So that in those with type 2 diabetes, weight loss can be as significant a treatment as any of the medications that are used for type 2 diabetes. So for some people, they're able to lose enough weight to where they are managing their diabetes without any medications. Those people still have type 2 diabetes, so they still need to be monitored. They still need to pay extra attention to food intake, still need to make sure that they're getting the regular physical activity, but those people can be managed without medications. And it's possible for people to have normal blood sugars after weight loss surgery and continue to have normal blood sugars without any medicine after weight loss surgery. And we consider those people to have what's called sustained diabetes remission. Sometimes you may hear people say diabetes cure, but probably the more technical term is sustained diabetes remission. And that's the scenario in which a person has maintained normal blood sugar without any medications for at least 5 years. And so we assume that the diabetes is no longer active at that point. Many people are able to have what we call just regular diabetes remission. And that's usually normal blood sugars without any medications for at least 6 months to a year. And many patients with weight loss surgery, the majority of patients with weight loss surgery, will find themselves very close to that category. Many people will find that they no longer have to take as many medicines for diabetes. Sometimes people are on pills and injections. And with weight loss surgery, they're able to be managed with just pills. And with further weight loss, they may be managed with just the weight loss and the physical activity. So if you have diabetes, whether it's controlled with lots of medicines or not very well controlled, and you're considering weight loss surgery, one reason to consider weight loss surgery is that there's a significant chance that your diabetes will be improved, and a good chance that it can be improved to the point that you no longer have to take medicines for the diabetes. You still need to have follow-up. You still need to have things like your eyes checked, your blood work checked, your feet checked. But you may be able to manage your diabetes without medications. And in my field, in internal medicine and pediatrics, the cost of controlling diabetes is significant. Medications for diabetes, particularly insulins and the non-insulin injectables, are very expensive. And so another benefit to weight loss surgery, if your diabetes moves from needing lots of medicines to control it to needing no medicines to control it, is the financial impact of not having to take as many medicines that are expensive. With diabetes, the best medicines, some of the newer medicines with great side effect profiles, are also the most expensive ones. And so well-controlled diabetes costs money. So if you have diabetes and you're considering the surgery and you're thinking about the financial impact of the surgery, particularly the cost of surgery, consider the monthly cost savings that you will have if you're taking fewer medicines, particularly fewer diabetes medicines. And so, if you're balancing, hundreds or maybe $1,000 in terms of the cost of the surgery, but you're not considering cost savings of $300, $400 a month, that you may be, you may find yourself in a situation, and it's more common than people think, that what looks like high upfront cost are actually significant cost savings from month to month. And so considering the impact of reduction in medications when you're thinking about the ups versus the downs of the cost. I feel like any topic where I don't talk about coronavirus, I feel like I'm missing a significant, whether we like it or not, coronavirus is the defining thing for our life right now, and it's everybody's life. And I would be remiss to not talk about obesity and diabetes without saying that obesity and diabetes are significant risk factors for severe coronavirus disease. And that if you're thinking about weight loss surgery, it's also helpful to think about the impact on other things that may not be diabetes and obesity. we're still learning about coronavirus, and we're still learning about, what exactly is the problem with diabetes and obesity. We do know that there are significant risk factors in terms of risk factors from hospitalization, risk factors for severe COVID, risk factors for death from COVID. You'll find obesity and diabetes at the top of the list. And in fact, in Mississippi, of the top four, obesity and diabetes are in the top four in terms of risk factors for death from coronavirus. So as you're considering weight loss surgery, you also should consider the impact of the potential impact of decreasing your risk from infectious diseases, considering the impact of improved mobility and things like that. But we don't know, it just hasn't been around. We don't know what the impact is for patients who have obesity and have weight loss surgery and coronavirus, like what their risk is if they lose weight. We do know for other conditions that weight loss is beneficial. So people who have obesity, even if they remain in the obesity category, we know that weight loss improves health in almost every other aspect. So we presume that the infection risk will decrease with weight loss. So again, as you're having, that detailed consideration of weight loss surgery, weight loss beneficial for preventing and delaying type 2 diabetes. Weight loss is beneficial for managing type 2 diabetes even without medication. Weight loss is beneficial for saving money on prescription drug costs. And also weight loss may be beneficial, particularly pertaining to coronavirus and the risk for severe coronavirus disease, even if you get it.